Community colleges in the area are often the catalyst for the development of innovative educational programs that they often do in conjunction with other entities. One such partnership brought Tri-C and the NASA Glenn Research Center together back in the early 90s. How it was developed is a feel-good story involving the federal government and local educators. Not always a successful combination.
This is a beautiful, beautiful, beautiful partnership. Congressman Louis Stokes was on his way from Cleveland back to Washington, picked up the plane and looked at the proficiency scores of the children in Cleveland Public Schools and was not a happy person.
When Lou Stokes was Congressman Stokes, very often my phone would ring on a regular basis and he'd say, "Doc, I've got an idea." And I knew that meant a new program. And he would always bring us great partners such as NASA when we were creating SEMA.
And so he basically came to us and challenged us and wanted to know what could NASA do to be able to help the young people in the Cleveland Public School system to bring them, expose them more to math and science, and so they can do better.
And said it doesn't make sense to have that kind of content and facilities out at NASA and have a place like Tri-C Metro Campus and not be able to help our kids. Find some kind of way to work through the problems and let's create a program. Thus was the creation of SEMA.
Would it way last in space?
SEMA, Science, Engineering, Mathematics, and Aerospace Academy, was born back in the early 90s. Today it is so successful it has spread to 26 sites across the country and is one of the government's most admired programs, winning a prestigious award out of 1,000 entries for its innovation and operation. Early in January, Tri-C and NASA bring parents and their children to the Visitor Center at NASA Glenn just to pique their interest in the study of space. But the turnout was amazing, surprising even NASA veterans. It was standing room only, but it didn't start out that way.
You know, when we first started, we thought, if we can get 50 kids, we'll be happy, And we started off with one SEMA site, and we expanded. The largest number of SEMA sites we've had across the country has been 26 SEMA sites.
In another best-kept secret category, you just cannot believe the space lab that is on the second floor of one of Tri-C's Metro Campus buildings. It is like a wonderland for the students who come in for regular Saturday classes. They are broken into teams, and every week they have new things to learn, new problems to solve, exciting new adventures that even include entering a portable planetarium where younger students can learn about the stars.
It takes kids who have not been doing well in school or who think that math is difficult, but we develop activities to get them really excited.
Each station in the Space Lab involves the planning of imaginary flights. Students have actual wind and temperature readings they'll need to launch their flight plan. They plan for the right amount of fuel, learn the miles to travel, and then get a chance to fly their plane on their imaginary journey.
Get off course. Get off course. Go back in the cockpit. Go down, go down.
It gets very tense because of the flight simulator's realism. Science experiments include an actual wind tunnel in which to study aerodynamics and another device to simulate weightlessness. While hugely successful, SEMA fights a familiar battle, the threat of diminishing budgets and a constant search for funding.
Unfortunately, we're not able to take as many children that are lined up to be a part of the SEMA program. If I had my way, I would service everybody that would be in the line to do that. Unfortunately, we don't have that kind of money.
There are many concerns going forward for healthcare. Well, the demand for healthcare services is going to increase as we have a bigger population and we have an older population and we have more things we can do for those people. And with that, we're going to need more personnel.
As we know, the healthcare area is going to play a huge role in the ongoing economy of Northeast Ohio. And we are certainly aligning ourselves with all the hospitals and all the healthcare providers. But we need talent. We need young people who think about careers in the healthcare area.
We're going to see fewer and fewer people becoming available to fill the gaps in healthcare provision for the population as we age. So it's imperative for us right now to focus effectively on how we're going to be training for the future.
When we talk about educating our children to be able to fill the needs of our region in the future, the healthcare industry looms as part of our economy that could pose real problems. Healthcare employment rises steadily, and hospitals are among the largest employers in the region. Some say there is already a severe shortage in healthcare workers. So how are our schools going to provide workers with the skills needed by the employing hospitals?
We work directly with the healthcare community to identify what their current and future needs are going to be for healthcare workers. And within our span of control with associate degrees, we are able to identify where we need to expand our programs, where we might need to start a new program for an emerging technology, and where areas might be waning.
But warnings come from the very people making the decisions. Just filling jobs is no longer the goal. The end product, the graduating student, has to be given the right tools.
Well, I think that the schools have got to aspire to the best possible education they can give our students. And that means that they have to be prepared to participate in the knowledge economy. They're no longer in the situation where they're simply competing with jobs for people from Northeast Ohio or Ohio. They're competing with people from across the United States and across the world. So they have to be well prepared for it.
This admonition cuts to one possible problem facing institutions of higher learning.
Most of our students, unfortunately, don't meet our requirements to get into our healthcare programs. Our healthcare programs are selective admission. So they have to meet certain criteria before they can get admitted into our program. The science courses, the math courses, even English, where we find that students have not necessarily taken the right courses in high school in order to get into our programs.
We would like to work with the schools at all levels. Again, at the elementary school level, getting young children interested in careers in medicine and science. At the middle school level, at the high school level, at the vocational school level, at the junior college level, and at the baccalaureate level, as well as master's and PhD programs, because at all of those various levels within our educational system, we will have needs in the healthcare industry in order to be able to hire those people when they come out of their education and training to become full members of our workforce.
Ironically, university hospitals, in the throes of a massive building program titled Vision 2010, finds it needs skilled workers at every level. But they have taken the initiative and are priming the pump, so to speak, in order to get more skilled workers.
As we're building our new facilities around Northeast Ohio, there is a shortage of people who are able to work in the building trades because of a lack of training and educational opportunities. We've entered into 2 new programs right now. One is with the Cleveland Municipal School District, where we're working with the vocational technical schools and providing opportunities for students coming through those programs. Secondly, we're entering into a new program called the ACE program now, which is an acronym, and it's an all-volunteer program. But we're going to be engaging high school and college students and exposing them to careers in engineering and architecture and the building trades.